Hello and welcome. My name is Wahyu Tresna Aditya. Will presentate the persuasive speech about CPR should be taught in school. There will be 6 parts of this presentation, but first, let's move on to the introduction part. According to American Heart Association CPR conducted early enough might save 100,000 to 200,000 adult and child lives per year. CPR keeps blood and oxygen flowing, increasing the odds of survival in those who had a cardiac arrest. According to ACC.org, congenital cardiac pathology is responsible for more than 85% of mortality among people under the age 25 in high school populations. However, by introducing life-saving skills training, such as CPR training into high school, the number of CCA deaths or cardiac arrest, as well as providing students with other important advantage. The next is the thesis. So what should school teach CPR? Because students from various backgrounds and demographic attend school. School cons fight on one of the finest possibilities for large-scale training. More significantly, there are a few facts that demonstrate why it is critical for young people to acquire life-saving skills and understand what to do in emergency situations. Okay, move to the next main body. First point. It teaches life-saving skills that may be used in any situation. The SCA's nature might provide high school and college students a false feeling of security. It also usually happens during periods of high intensity activity, although it can happen at any time and anywhere. This indicates that SCA can occur anywhere, independent of activity levels. Areas where high school kids congregate, such as restaurants, classrooms, school facilities, and recreational centers, might become the site of an accident. As a result, the life student save may not be that of a classmate. It may be that of a complete stranger or a friend or family member. Next is main body second point. It builds awareness and confidence in the event of cardiac emergency. The increased incidence of SCA among today's adolescents is due to the frequency of congenital cardiac effects. It's vital to recognize that the danger of death from SCA increases as people get older. This is thought to be the outcome of coronary artery disease that has developed over time. However, people who are predisposed to heart difficulties have an increased chance of developing this condition. As a result, tests for congenital impairments raise awareness about the danger of coronary artery disease in the future and identify the cases of SCA in high school and college students. Okay, we move to the next one is the main body third point. The life saved could be a friend, coworkers, family member, or a total strangers. Students have several limitations in their daily life. They may have obligations at home, such as a household task or child care, and they spend countless hours socializing with family and friends. Because of their high degree socialization, high school kids are especially vulnerable to witnessing someone suffer from cardiac arrest. Of course, family and friends will always be the most essential person in a high school student's life. Learning how to intervene when someone is expressing cardiac arrest or respiratory distress might save a life. Saving the life of a complete stranger, on the other hand, is one of the most fulfilling experiences on the planet. Also, it helps people to develop leadership skills. It is established a link between high school pupils and the rest of the world. We move to the last and not least, the conclusion. Every second counts in cardiac arrest emergency. CPR may be double the person chance of survival if performed quickly, which is why it should be taught in school. In the school, equipping all students with CPR training can significantly boost the number of first responders in community each year. Saving life? Students can use the knowledge they receive from obtaining a CPR certification to prepare for natural catastrophes or emergencies. Okay, we are the end of this presentation. Thanks for watching and listening, and see you.